Good afternoon. I'm Tom Stolz, County Manager for Sedgwick, here today to give the daily update regarding COVID-19. For any media partners who are listening in, please mute your microphones while we're going through the presentation, and then afterwards for questions, unmute as you ask. Going over the numbers. First from the national, working to the local. In the country, we're showing 3,454,190 as the number. That's a 3.6% increase since Monday. In Kansas, we are at 20,933. That is a 4.4% increase since Monday. In Sedgwick County, we are at 2293. That is a 6.4% increase since Monday. Periphery counties, Harvey has 99 cases, Butler 114 positive COVID cases, Cowley 90, Sumner 49, and Reno 141 positive cases. Of the Sedgwick County cases, the 2293, we're showing 962 recovers. And our death total has gone to 32, and I'll talk about that in a little bit. Comparatively speaking, from last Wednesday to this Wednesday, when I last talked with you, in Sedgwick County, we've gone from 1,652 cases to the 2293 that we're at today. That's a 38, almost a 39% increase in that week. The recoveries have gone from 768 to 962 in that week. That is a 25% increase in recoveries in that week. And our deaths have gone from 28 to 32, which is a 14% raise. Let me talk about the death count for just a minute. As everybody's trying to manage this, hospitals, nursing homes, etc., there is a lag of information many times, and the reporting process with deaths have to either go through the local health department or state KDHE. The 4 deaths that have occurred have not been since Monday. They have been since the beginning of the month, but for reasons unexplained to us, basically, but I assume because the hospitals and the nursing homes are so busy, there was a lag of time before that information got to KDHE, and then the information came to us. So these 4 deaths have actually been since the beginning of the month, since July 1st. Of course, we're at July 15th today, so it's not been 4 deaths over a weekend. It's been 4 deaths over a couple weeks that are just now getting reported to us. Regarding and I'll go into, let me jump back into some statistics, excuse me. Of the 32 people who have passed away, all are over the age of 50. Of the 32 COVID-19 related deaths, 27 are from long-term care facilities. Clearwater Nursing Home had 11. Chisholm Place with 7. The Manor with 3, and Diversicare with 4. New Life Home Plus has reported 2. So that's just the demographics of the Sedgwick County death cases. Our testing continues, will continue tomorrow. We are not testing today because we are moving from the tent location to a fixed site location, which will give greater comfort to our workers and to our clients who are coming to that location. So no testing today, but starting tomorrow, we'll be resuming. It's at the location will be 620 North Edgemore. For those of you who've been around, that's the old Armory location. So we are setting that up today, and we'll resume operations tomorrow. To date, Sedgwick County is still only testing symptomatic residents and certain high priority professions at no cost. To date, in Sedgwick County, more than 40,000 residents have been tested for COVID-19. Again, please call United Way if you want to schedule a test if you are symptomatic or meet one of those high priority professions. Testing is still quite busy. As we talked about last week, there's 3 components to testing. There's the sign-up component, then there's the testing component, and there's the report back component. The testing component is bogged down. The middle part of this, the national labs are overwhelmed. It's very typical to wait 6 to 8 days, and it's national. It's not just Sedgwick County and Kansas. We're all going through this. So we have to be patient on this. We're in Sedgwick County. We are seeking a faster local lab testing capacity. We are talking with potential vendors to get that done. Before the end of the month, we'll present something to the County Commission with options, and the Commission as a body, the Board of Health, will give us direction on which solutions to move towards. So we're working on this, but for the next week or two, it's going to continue to be slow. The results coming back are going to continue to be slow because the national labs are and the state lab to some degree, they're just very busy with the amount of infections that are happening nationally. We've had a visit with the hospitals on Monday. They asked that we please remind people to seek medical attention if you're experiencing serious symptoms or injuries, and this goes past COVID. We have learned that fewer residents are seeking emergency medical treatment at local hospitals because they are scared of contracting COVID-19. Call 911 or go to the nearest emergency room to receive necessary care, or contact your primary care provider for minor illnesses or injuries. Do not put that off, because what we're seeing over time is when people put that off, it develops into itself a problem that's maybe more serious even than COVID. So please, the hospitals are safe. They've been dealing with this for 4 months now. They've become very adept at separation of patients. And please, if you are experiencing symptoms that are serious, please get them taken care of, because not doing so leads to problems. During the Board of County Commission meeting today, we talked about the CARES Act a little bit more. A funding application for businesses and organizations will be available online on July 20th. The application will be reviewed during the BOCC staff meeting on July 21st. We'll be walking through that process. So if you're interested in applying, you might watch the meeting on the 21st, and we'll have a demo for you. An additional $91,000 has been spent on PPEs. $54,000 more dollars have been spent on personnel, mostly at the health department. Additional $35,000 for the Regional Forensic Science Center was approved. $20,000 for custodial supplies and $18,000 for technology. Currently, the county still has more than $96 million in CARES funding remaining, which we will begin dispersing after the application process to those who have applied. We also talked about budget this morning, and of course, like anything else we do in government these days, it's COVID-centric. County operations continue to be in pandemic response mode. We will be for the duration. The budget reflects costs associated with doing business and the response to COVID-19. We are trying to not reduce county services in our 2021 budget, and any budget details can be found online at www.sedgwickcounty.org.
A question regarding the timing. I know obviously you're dealing with the delay from the testing. How much can you speak to how that is going to impact, for example, that July 4th timeframe? If you were infected around July 4th, but you maybe not are symptomatic for another week, go get your test, and then you have to wait to get the test results back. How soon do you think we're going to be able to really tell if that July 4th timeframe created a large increase in cases?
Right.
How far out are we?
So, and we're all concerned about the July 4th potential spike. We don't know yet. The numbers will read themselves. But to answer your question, it's a 7 to 14 day lag, even for the infection to manifest itself. Those people then have to go get tested. And let's say there's a 7 to 9 day delay on receiving test results back. Now all of a sudden you're into the July 25th area or so. So we'll have to wait for that time period to get a true assessment on what July 4th either did or did not do to the community. So it's tough when you don't get fast test results back. It's harder to manage this, and I think that's why the commission and staff it's so important that we come up with a local solution to this, particularly with school around the corner and businesses trying to stay operational. Rapid testing just has to be part of the equation. If it's not, we're going to continue to struggle. So, July 4th we won't be able to get a true assessment on that probably till the third week or so of the month.